evening. You are listening to Studio 7 from the Voice of America on Wednesday, June the 3rd, 2020. And this is Livetalk Diaspora Forum. I'm Jonga Kandemiri.
And I'm Gibbs Dube.
Tonight on Livetalk Diaspora Forum, we continue looking at the coronavirus pandemic and how it is wreaking havoc in many countries, and looking at Zimbabwe, where many of the returnees are found to be positive.
Please note that this is a pre-recorded show, so we are not able to phone in. So now when we are looking at Zimbabwe, Chonga, in terms of COVID-19, we know that right now there are 206 cases and 29 recoveries. And then we know that 4 people have actually succumbed to COVID-19. And out of the people that have been tested, all of them, they amount to roughly about 48,000, just slightly above 48,000. And then when we look at global figures, there are 6,411,473 people that have actually contracted COVID-19. And out of these people, 2 million roughly around there have actually recovered. And about 380,800 have actually died. And when you look at the United States of America, Chonga, there are 1,832,412 cases. And out of these people, 106,198 have actually died. So it's a critical situation, Chonga, when you look at what is happening globally.
Ndizvo Gibbs tichitarisa zviri kuitika kumusha nhasi nyaya yedu yatiri kutarisa inyaya yekuti uwandu hwevanhu vari kubatwa nechirwere ichi uri kuramba huchikwira muZimbabwe nedzimwe nyika dzakapoteredza Zimbabwe. Tinonzwa kuti muSouth Africa uwandu huri kukwirawo zvakanyanya. Tiri kuona kana imo muno muAmerica manga matunhu kubva panzi vanhu vatange zvakare kufamba tiri kunzwa kuti uwandu huri kuramba huchikwira. KuZimbabwe pari zvino vanhu vabatwa nechirwere vanokwana kuita 206 kana 206, kuchiti 29 vapona kubva kuchirwere ichi, uye vana kana kuti 4 vashaya. Pasi rose tinoona kuti tichiiteera zviri kuburitswa neJohns Hopkins, vanhu vanokwana kuita 6.4 million kana kuti 6,418,000 vabatwa nechirwere ichi, kuchiti vanokwana kuita 381,064 vafa kubva kuchirwere ichi. Uwandu hukuru kwazvo Gibbs hwekuti nyika dzakawanda dzarasikirwa nevanhu vanokwana kuita 380,000 vashaya, tichitarisa kuti pane 6.4 million vabatwa nechirwere ichi pasi rose.
Kunjalo-ke khonokho zulukani ndabakhulunywa nguJonga, kulabantu-ke abayi6,418,000 sibona ngani kuyakhuphuka sonke isikhathi nxa sibiza amafigures wona lawa kuyakhuphuka kusiyaphezulu. So-ke abantu bona labo 6,418,478 sebebanjwe umkhuhlane umhlaba wonke jikelele. Kuzobuya abayi381,890 sebebhubhile. Qala siyakhumbula sithe sivule uhlelo lolu ngathi 380,000 sokukhwelile futhi kwaphezulu. So nxa sokubuya-ke kwelemelika bedlula isigidi lengxenye 1.8 million abantu asebegule umkhuhlane lo. Kuzobuya-ke asebebhubhile 106,198. Kule Zimbabwe siyakwazi ukuthi 206 asebegule umkhuhlane lo, 29 sebesilile. Kuzobuya-ke abayi4 sebabhubha, abedlula 48,000 sebathestwa. Khona manje nxa sikhuluma kule COVID-19 lockdown kwele Zimbabwe. So the topic today really goes deeper into issues concerning what is happening in Zimbabwe. And one of the issues that we're going to interrogate today is the assistance that is being given to Zimbabweans by those that are living in the diaspora. And we've got an expert here in terms of public health who's going to tell us a bit about COVID-19 and its kind of results and all these kind of things. So now, Chonga, I think we've got our first guest, and that is Dr. Matthew Nyashanu. He is a professor at Nottingham Trent University, and he lives in Birmingham. He is in public health. And then we also have, Ezra Chisa Sibanda. He is our correspondent based in London. So he's going to be telling us about the Ezra Chisa Sibanda initiative. He's helping a lot of people, in London, in Zimbabwe, and other places too. So recently, Chonga, Ezra Chisa was actually praised by the mayor of Bulawayo Solomon Mkoni. So we've got a video. I'll play this video, then we'll come back to you in a few seconds. Hold on and hear what the mayor said, Jonga.
Bonani, good morning, good afternoon, good evening, wherever you are on this part of the planet. On behalf of the city of Bulawayo, Standa ukubonga i-Ezra Jesus Band and Friends Initiative for donating ama-beds esiwabonileyo namhlanje, which we commissioned 20 beds to make i-Stony Grove Hospital ready for admission of ama-COVID-19 patients. We have seen over the last day a surge in numbers of coronavirus patients. When we went to sleep yesterday, we had only had 3 active cases. Now we have 5 new active cases to bring the total to 8 active cases. And with the winter coming, which we are yet to be out of the woods, and the situation may require that we have more admissions at Stony Grove Hospital. So stand ukubonga u-Ezra Jesus Banda and Friends Initiative for the kind gesture, generous donation, which they've done now by providing 20 beds. Want to thank all his partners who have made this day possible. Siyabonga before the city.
Yeah, so that is the mayor. He's actually thanking Ezra Chisa for his initiatives and all these kind of things. So Ezra Chisa is among people who are actually raising funds and doing all this kind of business. So over to you, Chunga.
Thank you, Gibbs. First, I would like to congratulate Ezra and friends for that initiative. Ndo zvatinogara tichitaura mururimi rwamai kuti ziva kwawakabva usakanganwa kwawakabva, and that is very, very good, Ezra. I think we also need to copy that from you. And also, I would like to welcome to the show Dr. Matthew Nyashanu, as Gibbs said earlier, that is a professor at Nottingham Trent University in the United Kingdom. Maybe I can start by asking Ezra to just tell us a little bit or give us a background of the initiative.
Go ahead, Ezra, the background.
Okay. Thank you very much, Jonga. Thank you very much, Gibbs. This Ezra Chisa initiative was created in 2010. Basically, why it was created, it was meant to take care of the less privileged kids in our society. We're taking school children to paying their school fees and paying their university fees. We managed to school about 35 students who are actually schooling. 3 of them have graduated from nasty universities, but unfortunately, as you know, the system or the situation in Zimbabwe, they remain unemployed. One is already gone to South Africa. And then afterwards, we're looking at the well-being of the girl child. We managed to pick and take away the girls who were roaming the streets, selling their bodies, child prostitution. We managed to take them back to school. So these days, we were looking at the COVID situation in Zimbabwe. Therefore, we started fundraising for a hospital in Bulawayo called Stony Grove. This is a referral hospital which caters for Masvingo, Midlands, Matabele, South and North, and 5 provinces. They refer their patients, COVID patients, for the isolation center, which is Stony Grove. It didn't have any beds at all, didn't have any PPE. So nurses were saying they won't attend to patients because there were no PPE. We managed to buy the PPE, we managed to buy the beds. So Stony Grove now is ready to take any patient from now on.
Yes, sicela ukufaka khona ke ngesintu ukuthi ukwendlalele kwenza ukuthi siqhubeke sisiya phambili ngamafutshane baba Sibanda.
Okay, as a Chisa initiative kusukela ngo-2010 ibikhangela abantwana abafundayo, incedisa laba abaswelayo, incedisa laba ke bafuna ukubhadala ama-school fees, abanye sebabhadala baze bafika le university, abathathu baqeda eNUST, oyedwa sese-South Africa asebenza, ababili bahlezi ekhaya, awazi ekhaya umsebenzi ayikho, njalo besiphathisa labanye abahluphekileyo. Okwamanje sezwe iToni ukuthi-ke amanesi lamadokotela bathi angeke basebenze ngoba abalanto lezi zokuthi bazilondoloze ukupreventa imikhuhlane. Sabathengela-ke yonke igiya lothu ama-PPE, protective clothing, abayigqokayo, ama-gloves, ama-maski, ama-suits abo. Sizothola le mbheda kayikho, ama-patients alala phansi, athenga-ke imbhede ngu-20, sayisakhwaphana. Okwamanje-ke i-COVID leyo, iToni Grove simelele loba ngasiphi isikhathi ukuthatha ama-patients iwalalise khona ngoba kade ungela mbheda all along.
Yes, sicela ubambe khonapho Chisa. Jonga, sungangena khonapho mfowethu.
Yes, ndofunga amanzi kwazvataurwa naEzra Chisa Swanda. nevamwe vake vaari kubatsirana navo vakakwanisa kunge vachiunganidza zvikwanisiro zvinodiwa pachipatara cheTon Grove kuti chinge chichikwanisa kutambira varwere vanenge vaine coronavirus kana COVID-19. Vakakwanisa kuwanisa mibhedha. Tanzania veguta roBulawayo vachitenda zvikuru kuti vakwanisa kuwaniswa mibhedha inokwana kuita 20. Koitawo zvikwanisiro anonzi maPPEs kana protective clothing zvinoshandiswa mukudzivirira kutapurirana kweutachiwana zvakasiyana siyana. Vari kuti vanobatsirawo zvakare vana, kubhadharira vana mari dzekuenda kuchikoro. Panotove nemumwe apedza pauniversity. Koita vanasikana vanga vachishupika vaitengesa miri yavo mumigwagwa, vanga vakuitawo upenyu hwekuzvipemhera kuti vange vachikwanisa kurarama nenzira dzisina kutsarukana. Vakakwanisa kunge vachiburitsa vamwe vevana ivavo mumigwagwa vachivaendesa kuchikoro. Chinhu chinotendwa zvikuru. Ezra, thank you so much. Dr. Gibbs, you can also bring in Dr.
Yes, go ahead. Pose a question.
Yes, Dr. Nyashano, we are looking at the rising numbers of COVID-19 positive cases in Zimbabwe. Recently, we heard about 40 something, and all of a sudden, they shot to 73, from 73 to 100 something, and now we have 206. And most of these people are returnees from the diaspora. What can you tell about this development?
Yes, thank you very much, Jonga. Thank you very much, Gibbs. This is a testimony that our health system is not working effectively. And this is not new in Zimbabwe. It is a characteristic of any low and middle income country. However, our own is exacerbated by lack of craft literacy and craft competence in terms of managing public health surveillance or systems and strategies of protecting the public during pandemic times. I am very worried that we are having these small numbers, but the jumping of epidemiological statistics from 40 to 70, now to 200, it's enough testimony that our surveillance is at fault. It could be that we have got thousands of people who are infected by coronavirus at the moment. One of the things that is very worrying, Gibbs and Jonga, is how the people are quarantined when they get to border posts. Right? They are taking people into designated areas. These people have not been tested. And when they get there, probably there's only one who is positive. Those people are going to be infected because of the conditions where they are being kept. So it might be easier for us, or the government of Zimbabwe, to actually consider strategies that are used by weak infrastructure of health to try and maximize the strategies of preventing pandemics. For example, they know that they don't have food to look after people. They don't have enough water. If people get there, they are going to contract other diseases and they come out with a comorbidity. So what they might actually do is to divert the very meager resources that they have to test, fast testing, right? If they have fast testing, and they will be able to detain only those who are positive, and those who are negative can go and self-isolate with their relatives, where they are being looked after better than what we know. The government of Zimbabwe has no capacity to look after people.
When you're looking at self-isolation, there are complications there, Professor. And one of the complications is that people may not know how to handle such cases. So, like you send somebody home, from the the quarantine center to give this place. How are people expected to handle that kind of patient?
This is the point. That is where our government should actually channel its meager resources instead of bundling people and put them in a place where they can have a comorbidity. Now, what they should be doing is to conjure a very strong public health education to the community about how these people can self-isolate themselves, probably maintaining the social distance and also making sure that this social distance, they can have also a designated room where they are living for a designated time, probably 7 to 14 days, whereupon if they see that the person is not affected, then they can later on join the family. But at this point in time, we are trying to address several things that affect human beings in as far as public health is concerned. One of the things that we are overlooking when people are detained in a place like Belvedere Teachers College, at times where there's no water, these people are also impacted upon by their mental health, which is not being addressed. I had somebody spend more than 23 days there and, is getting the food which is not up to standard. It is like a person is in remand. In public health, we talk about what we call social justice in disseminating public health strategies or managing public health of people. And this is some of the things that they should consider. And this can actually help because they would have diverted the meager resources which they have to try and educate people through health promotion and also to test the people. And that can be better than bundling people, putting them together, where they will come out with other infectious diseases which we don't know because of the conditions of where they are. So this is quite very worrying.
Jonga, over to you.
Yes, ndokumbira kuti Dr. Nyashanu vangotsanangura nerurimi rwaamai kuti vanhu vanzwe kuti mashoko amuri kusvitsa zvii zvamuri kutaura, nokuti ndandaisa mubvunzo yokuti tiri kuona kuti vari kubatwa nechirwere cheCovid-19 vakawanda ndevanhu vanenge vachibva kunze kwenyika kuno kudiaspora kuno. Vasvika muZimbabwe vari kuendeswa muma-quarantine center kana munzvimbo dzavari kuchengeterwa kwemazuva anofanira achigarwa kana 21 days, asi vazhinji vakuzodarika zvavo tikunzwa vamwe vakuma 30 something days vakagara vachimirira kuti vange vachinzwa maresults avo. Saka ndaida kunzwa kuna Dr. Nyashanu kuti vanoti nenyaya yekuti vazhinji vari kudzokera kumusha ndo vari kuwanikwa vane chirwere vachigara muma-quarantine center mavari kunzwa vasi kugara zvakatsarukana.
Ichokwadi ichocho chekuti vanhu vanenge vachibva kunze ndo vari kuuya nechirwere checoronavirus. Zvino tikatarisa kuti kana vanhu ava vauya muZimbabwe vari kubatwa sei, ndinofunga kuti isusu tinofana kuziva kana kuti vana mazvikokota vedu veutano wepublic health vanoshanda muZimbabwe vanofana kuona kuti vangashandisa sei mari shoma yavainayo kuti zvibatsire kuti kana vanhu vauya ava vanobatwa sei, nekuti iye zvino vanhu vari kuti vapinda. Chokwadi hazvireve kuti munhu wese abva kunze anenge aine chirwere. Dzimwe nambo pane imwe cohort kana kuti rimwe group panenge pasitorina munhu anenge ainacho chirwere ichocho, kana kuti panenge paine 1. Vanhu ava vozosanganiswa, dzimwe nambo vamwe vabva kuSouth Africa, vamwe vabva kuAustralia, vamwe kuUnited Kingdom, poita 1 anacho. Tikanotarisa, ndandichitevera nyaya izvi zvakanyanyisa chose, tikatarisa maconditions anonogara vanhu, maconditions awa anoratidza kuti vanhu havasi kunyatsa kudzivirirwa muchirwere ichi. Zvinotogona kutoti vanhu vanenge vari ipapo pakembi pacho vachatapurirana chirwere ichocho. Kwete izvozvo zvega, zvimwe zvinhu zvinogona kuitika futi muchirwere ichi ndezvekuti vamwe vanhu vasitorina kana chirwere checorona vanogona kuita inonzi comorbidity, vobva vatangisa kuwana zvimwewo zvirwere zvinovabata votozvitapurira kune vamwewo zvavanga vainazvo. Saka zvese izvi hazvisi kuitwa. Zimbabwe haina tatingati health system yakasimba yekuti inokwanisa kuita zvinhu zvinhu zvakanaka chose panyaya yepublic health. Asi zvatiri kufunga kuti zvinenge zviri nani dai vakanga vachiisa mari yavo yakawanda kufast tests nekudzidzisa vanhu kuti kana munhu achiita self quarantine zvinoreva chii. Munogona here kuona kuti paanenge achishandisa zvinhu zvake ashandisa zvinhu zvinozokwanisa kunge achigeza maoko ake zvichimendeniwa vanhu kuita kuti kana vakasvika vakatesta vanhu first test tinoziva kuti mafirst test ari fault, but then anotiratidza vamwe vakawanda kuti vanenge vaine chirwere nevasina. Saka izvozvo zvinoita kuti vanhu vakawanda vabve vaenda voditena havo vaya vabata kuti vanotori nechirwere, vobva vaenda uko vachinorecover vasingape vamwe. Asi zvaakuitika ndezvekutoti vaakutova an infectious sender itself, nekuti kana vanhu vobva ikokoko nevanga vasina vakuenda vachinotambidza kuhama dzavo. Saka kudzidzisa vanhu ndo kwakasimba, kuchiteverwa nekunge tichitesta vanhu.
Okay, thank you so much.
Thank you so much, Dr. Nyashano.
Yes, let's bring in Ezra Chisa Spanda, who's talking about his initiative. So, Chisa, what other things, apart from beds and, thermometers and other things, did you actually provide for some of the facilities in them?
Okay, we provided for this COVID, we provided the N95 mask, which are recommended by World Health Organization. And we also have the 3-ply mask for people to use. We've got over 10,000 gloves. We've got the space suits, which are worn by the people who are working with the infected patients. And then as well as we bought food on top of that. We actually bought the pneumonia beds, which can, I think the health expert can explain what the pneumonia beds are. So, because those are what are needed for the people with infection, like a coronavirus. So we also bought some food for the patients. So hopefully everything's ready now for Tom Group.
Yes, cela ukufaka ngesindebele ukuthi okunyela kuthengayo kambe ichisa kuyini nxa wasicasisela nje ngafishani khona.
Sathenga ama N95 ama-mask kodwa ama N95 ayiwa afunwa i-World Health Organization asetshenziswa yilabana ke abezempilakahle nxa behlola laba abagulayo ukuthi bangathathi umkhuhlane, njalo amalokhu emasutu abagqokayo amabhatshi abo namhlophe lokufakwa ekhanda lenyaweni ukuthi bangathathi igcikwane, njalo sabathengela ke lalokhu kuthiwa ngama-gloves nalama 3-ply mask lawa ke ukuthi abagqoke izisebenzi ezinye zisebenza khonapha eTonga ezithanyelayo konke lokhu kunye lembheda le eyalabantu abagula ngalokho kuthiwa sama-infection, imbheda le yabe igenqulwa ilaliswa ngani ngesayidi siyale lale ukwenzela ukuthi umuntu lwana isifuba sakhe lesena siyaqakanyiswa ngoba nxa ilele phansi umuntu le-pneumonia uyabe sevaleka. So imbheda yangikhona esayithengayo yiba bebechithi bafuna imbheda enjalo, yimbheda esayithengayo sesithenga lokudla ukuthi kuncedise ukuthi unikwe ama-patients. Okwamanje i-Thorn Group ilindile ngoba le patient ihambe yengena ungela dubo.
Yes, yes,
Gibbs, I want to go back to Dr. Nyashano.
Yes.
Dr. Nyashano, we always hear about this contact tracing. What can you tell us about contact tracing? Because I've heard several health experts calling on the government to emphasize on the need for contact tracing.
Yes, contact tracing involves following up people who might have met somebody who has been infected. So this will involve who are those people in the first place, and that can lead to several people that have been met by that particular person, in which case those people can actually be taken into, right, they know that these people need to test, and they can actually go to a health facility and be tested. But this, I must say, it is a very expensive exercise, which I think in the case of Zimbabwe, with a very low, very poor internet systems and also the communication systems, because it actually depend on a system that has to be so robust. You know, the one that was that was launched 3 days ago in the United Kingdom, as developed as they are, at first they were having some problems with that communication. So this contact tracing is quite very important, But if it can be established at the level of a low or middle income country, yes, it's fine. It is to what extent can we follow up people who will then go into Buera rural areas or go to Bubi? It will be very difficult for us to follow those people. And sometimes we'll be told, oh, they had this phone, they left it because the phone cannot get there. But it is, however, a very noble strategy, especially if the communication is very good. Probably middle income countries like South Africa can also inject that effectively, because it also runs alongside a very robust communication system.
Thank you. Yes.
Maybe
Yeah.
vanogotsanangura neshona kana muchigona kuti ndevele kungokhuluma futi Dr. Nyashanu kungotsanangura kuti mubvunzo wandakubvunza iwe kuti tiri kunzwa nyanzvi dzezveutano dzakawanda dziri kukurudzira kurondwa kwematsimba evanhu kana kuti makafambwa nevanhu vari kubatwa vaine chirwere cheCovid-19 kuti vakafamba nemupi kuronda tsimba iri kunzi muchirungu contact tracing. Ndandabvunza kuti vatsanangure kuti zvakakosha zvakadii zvekuona kuti vafamba papi, vamira papi, vadya papi, vabatana nani, vasangana nani. Tsanangura yenyu Dr. Nyashanu.
Inoitwa contact tracing muchirungu chinhu chakanaka zvikuru sei kana muchinge muchiita public health interventions, especially kana tine chirwere chakaita secorona ichi. Asi ndinoda kumbotaura ndichiti kana tichiita nezvecontact tracing inoshanda ine zvinhu zvakakosha zvakaita senge dzirunhare dzatinoshandisa, ende vanhu vedu vanofana kunge vaine runhare rwekuti kana tikange takuvatevera tinokwanisa kunge tichizovabata. Yakanaka zvikuru, asi chinozogona kutidzosera kusure munyika yakaita semuZimbabwe inogona kushanda mumadhorobha, asi kana vanhu vazoenda kure uko, toti munhu aenda kuBhoera kana kuti aenda kuBhubi kana kuti aenda kuya kune kwatinoti kure, zvinozonetsa kuti unonga wakuramba uchiteera munhu uyu ende hauchazozive kuti munhu wacho ari kupi, kana kuti vakanga vari vanhu vanenge vapinda muZimbabwe zvinenge zvaakuda kuti futizve kana pavanonochinja nhamba vange vachitaurira futizve vanhu pavapinda pabhodha paya. Saka zvinhu zvakanaka zvikuru, asi zvinenge zvichida communication system kuti vanhu vange vaine mafoni, plus zvekunge kuine broadband yakasimba recording system yesurveillance yakasimba as well. Nekuti chimwe chinhu chinotinetsa muZimbabwe ndechekuti isusu hatina bazi rakasimba rinotora mashoko kana kuti zvinenge zvabuda mupublic health zvekuti tikangotopinda mugweru takutotaurana nanhingi, topinda mubhuruwayo takutaurana nanhingi, toenda kucholocho. Hakuna maoffices akasimba akaita inonzi public health surveillance system. Kwete zvipatara ba, but zvipatara zvichishanda pamwe chete nepublic health surveillance system inove inoshanda neruzhinji rwevanhu.
Tinotenda zvikuru Dr. Nyashanu. Thank you so much. Please do stay on the line, Gibbs.
Yeah, I think we've got a caller who has got a question for the doctor before we proceed to Ezachisa Sibanda. Utanga ahambi ngakezinjalo ngengitsho ukuthi udokotela lapha uthini, udokotela Nyashanu ngokukhuluma kwakhe uthi i-contact tracing le jonga okumele yenziwe kumele kube le mobile phone eyabe ingani iyasebenza okuzwayo, njalo khonapho-ke kumele kube lamahhovisi lapha lalapha awenza i-surveillance ukuthi umuntu nxa esuka eHarare esiya eBubi kumbe esuka eBubi esiya eGweru uyabona kumtracer phela umbona ukuthi uya ngaphi. So uthi khonokho nxa ungenziwa kuba lula ukuthi ukwenze, kodwa umuntu angatshintshi inombolo yakhe-ke uthi kuba lenkinga khonapho ukuthi nxa i-mobile phone number ungayitshintsha kwahle kukhathe off. Kumbe emakhaya lapho ngani akuzwakali khona ukuthi umuntu nxa ekhuluma ngefoni kumbe into ezinjalo uthi kuyakhathazana khonokho. So siyamuzwa sibili wothi mbisele-ke ubaba lapha sizwe ukuthi uthini nxa ebuza udokotela ngakhonokho afisa ukubuza ngakho. Hold on khonapho jonga simuzwe ukuthi uthini ubaba lapha.
Okay.
Kambe ngabe linjani Mahlebezulu? Okhulumayo nguSibonkosi Mthunzi. Ngilapha eJohannesburg. Kodwa ngokuzalwa ngugodlwayo. Mina nginombuzo lapha, umbuzo wami ukanje. asithi nangu umama usebanjiwe ukuthi unekhorola, umama lo unengane encane uyancelisa, kambe kuyaba kufanelekile yini ukuthi engaqhubeka encelisa ingane, kumbe sokumele ehle eme ingane yesihlala yodwa le isale endlini umama sehambe ku quarantine leyo yini? Ingumbuzo ongani uyanhlupha ngoba silabo mama abaningi abanezingane ezincane. Ingumbuzo wami lo, nxa ngingathola impendulo ngingajabula kakhulu. Ngiyabonga.
So the gentleman is asking a question here, and it's not a complicated question, but it's a very straightforward question. If your wife has got a kid and is suckling that kid, what has to happen, Dr. Nyashanu? That's a question. And says maybe she should stop suckling the kid, she should be isolated. What happens if that happens?
Yes, definitely. It will be in the best interest that the kid is saved. And we don't know at that particular time whether the kid has not contracted the coronavirus. But if so, it will be in the best interest that the baby can be given some other milk and be a little bit separated from the mother. Having said that, you will find out that it might be very difficult, but I think if the baby has not yet got it, it will be better, and it will be in the interest of public health that they can be quarantined from the mother, and they can use formula milk probably to feed the baby.
Yeah, uyakhuluma ke udokotela nxa umzwile mfowethu wona obuza umbuzo uthi kuyenzakala ukuthi umntwana enxe uyabe ngelawo lo mkhuhlane, nxa engelawo kuhle kakhulu, kodwa ke ukuthi asevwe umntwana abe kahle kumele ukuthi akhitshwe kunina, abe sedingelwa amafomula ochago, abe senathiswa nje uchago loluyana elwaziyo. Ngiyakhumbula ekhaya kwakule amafomula atshiyeneyo, ngeke ngamenshana amabizo, bakhanzanise ngiwathengisa. So ke khonokho ke uthi kuyanceda ukuthi umntwana asuswe kunina, ngwana kunjalo. So bamba khonapho ke dokotela, just hold on there. Let me go to Ezra Jesus Spanda. So Spanda, looking at what is happening in the diaspora, we know ukuthi kule nkinga enkulu kakhulu. Nxa sesikhangela ukuthi abanye abantu bayalamba, abanye bayaswela lokuthi benzeni. So lenzani ngakho khonokho diaspora? Ngeke ngabona usulokunye okwenza eGoli ukuthi abantu sebenikwa ama-food hampers, into ezinjalo. Akutshela abantu ukuthi yini lokhu Chisa?
Abantu babona imikhankaso emingenza intinga labantu ukudla. Ngikhuluma lokuthi kulantu abalambileyo, into engizibhala ku Facebook. Ngase ngithola ukuthi kule dona embhalele abanye abelungu basesithi we saw your works, that you somebody who is working with the people. We want to donate food parcels to people in South Africa who have loved you to be here, you doing it. Then because of travel things, I couldn't be in South Africa. Then I told them that I can find an organization in South Africa. So they said I should contact the organization, write to the organization, write to them. So I managed to get a contact South Africa, got one lady there, who's Vichy, Nobushe, got a registered organization charity. So they are now channeling all that. She's managed to feed 120 families. So they continue giving. They said they'll be giving around 40,000 rands every week. I don't know how long they will go on. So they're actually helping buy the food hampers and giving to people in South Africa. And then here in UK, what I urge people through my Facebook is that people who come from different areas, different communities, they should organize themselves in groups. For instance, if somebody comes from Mtare or comes from Mfakos or comes from Cholocho, they should get together, organize themselves and support people in those communities where they come from. Because if you say, let me collect for everyone, it will be very difficult for me to give someone in Masvingo, to give someone in Gwanda, to give someone. So I said people should group according to where they come from. And then they can as well identify people in those areas who are vulnerable, the old ones, people are suffering, and then start feeding people where they come from originally. So that people have been doing that. We've seen the Toronto people have done it. We saw someone from Shabane, they've done it. In Kwekwe, they've done it. Bulawayo, they are doing it. So people are actually coming up. They say it's a great and noble idea. So this is how they are helping their own communities, because nobody's going to help their communities.
Yes, clarify ngasinto sibili ukuthi wenza lokhu lalokhu lalokhu nje ngamafishane kaka.
Okay. Yeah, into khona ukuthi abantwana babone umsebenzi yami ku Facebook, ngilandwe ngidona abantu eSouth Africa abanye abelungu bambhalela ngacanga ukuthi maybe oqala into okudlala base befaka le phone number zabo, hayi sakhuluma ke emafonini base bentshela ukuthi bana bafuna ukusiza abantu babone ngikhuluma ngibhalile ku Facebook ukuthi abantu bayalapha eSouth Africa abantu beZimbabwe, so kodwa abafuni ukukhunywa amabizo wabo. Mina ngahamba yini ka abantu ukudla lokho ngase bathi ngise England mina ngizabatholela umuntu eSouth Africa sengithola ke charity ka Sisuvichi enhlelo ngibona inika abantu ukudla base besiyamnika i42,000 rands ukuthi athengele abantu ukudla okwaqala eviki leyi wabanika ke losisi bathi bazabuya ke eviki ezaba bese enye 40, so abanjela ngokuthi imali yakho imali yonke bathi bazabe bencedisa benika abantu ukudla labase South Africa. So siyababonga kakhulu ke ama donors. Kuthi kunjalo ke ngase sithi abantu base UK loba base Australia nga ukuze sincedise abantu ekhaya ngesikhathi secorona asiqoqaneni singamaqembu lapho siphuma khona esidaba kho besizalwa khona nxa uzalwe eGwanda sithele iGwanda group bese lidinga abantu ke labantu sithi bahluphekile kakhulu abadubeka kakhulu abangela kudla bese lithatha libathengele ukudla libanike ngezigaba lapho elisuka khona. So lokho kwabalula ngoba nxa eziyaqoqwa yimi kwakuzabanzima abanye bathi ayi uthethe imali kimi but umuntu wakithi kayithola ngecholotho umuntu wakithi kayithola ngePlumtree eGwanda eMasvingo, so yiko abantu bafake baba iziqumbi ngapha bavela khona.
Yeah, wazwala kakhulu Chisa Jonga ngena khona pho mfowethu.
Yes sir, kandiende kuna Dr. Nyashanu mubvunzo wabvunzwa nemuteereri Gibbs, mubvunzo wandaitombozvifundzawo ini ndofunga uri muvanhu vakawanda wanda unzwisisa kuti amai vari kuyamwisa vakabatwa vaine chirwere checoronavirus kana COVID-19 zvizvi zvinoitika kumwana chinotapurirwa kumwana here? Mwana matanho apa anofanira kutorwa pavanenge vakuenda kana kuisolation nezvimwe zvakadaro. Dr. Nyashanu tibatsirewo neshona.
Yeah, one of the zvinhu zvandoda kutanga kutaura ndezvekuti izvozvi munana mazvikokota vecorona vari kustadha nezvecoronavirus vanhu vazhinji havasati vave nefull understanding kana kuti ruzivo pamusoro pechirwere ichi. Vanhu vachiri kutsvaga kuti chirwere ichi chinofamba sei. Pane manhingi akambotanga kubuda mashoko akatanga kubuda pasi pane umbowo hunotaridza kudero kuti ruzhinji vana vadiki vanogona kubatwa nacho asi hachiite hasha dzachinoita nevanhu vakuru. Zvinoonekwa asi kune imwe condition yakuonekwa futi iri kunzi iri kubuda muvana vadiki ichikonzerwa nechirwere ichi. Saka todzokera pamubvunzo wenyu wekuti kana munhu achimwisa mwana iye obatwa nechirwere checoronavirus, kuzoona kuti munhu abatwa nechirwere checoronavirus nekuti pakati pemwana namai hapana yatingati social distance iyai zvekuti chirwere ichi chinogona kutapurirwa kune mwana, asi zvinenge zviri zvinhu zvakanaka kuti kuri kuona kuti mai vadero zvakanaka kuti vachipatsanurwa nemwana pane kuti zvingosiyiwa zvakati mwana ngaagare naamai, nekuti yatinoti isusu shielding ndeyekuti munhu ari vulnerable chero zvaitika azvo munozosara moita matest asi vanhu ava vaviri ava vatopatsanurwa. Munogona kuzotoona kuti nemwana anga atobatwa ake nacho, mai vanga vabatwa patazozviona, asi zvinogona kuti pachiri kutanga kuna mai hachisati chabata mwana. That's lucky. And any safe case in public health inotonzi it's a positive. Zviri positive to public health and well-being.
Thank you so much, Dr. Nyashanu. Gibbs.
Yeah, so Jonga, we've got a lot of tweets from Nick Mangwana, who's the Secretary of Information. So one of the tweets is talking about what is going to happen in terms of schools opening, you know. So he sent this about a few hours ago. He says, Cabinet approved that only exam classes should initially open schools in order for schools to be able to put prevention measures in place. These measures include social distancing, limiting of class sizes, hand sanitization, mandatory wearing of masks by students and teachers. Then it goes further to say students will be expected to return home immediately after exams. Depending on the outcome of the first phase, a way forward can then be mapped for other classes, and the Minister of Primary and Secondary Education will subsequently issue a date for the commencement of other classes. So those are two tweets there. At the same time, there was something from the Zimbabwe Republic Police. You know, their Twitter handle is Zimbabwe Republic Police. So they're saying the ZRP urges members of the public to observe that the country is still under level 2 national lockdown in order to manage the COVID-19 pandemic. Only essential services, businesses in the formal, commercial, and industrial sectors were exempted to operate during this period. So let's remember that there's still a lockdown in Zimbabwe, and many vulnerable families are having challenges, Jonga. So kukhanya ngizana abantu abanye abala manzi, abanye abala kudla lokunye okutshiyeneyo. So khonokho kuvele kwenza ukuthi abantu bengani badinga uncedo oluvela phandle. Uncedo lungabuya in the form yaleyo okhulunywa ngubaba uMatthew Nyashana obuya ngezempilakahle ukuthi kumele kwenziweni. Kuzobuya ke ezatshisa sibande lapho uyakhuluma ukuthi kulabantu abancedwa ngendlela ezitshiyeneyo. Abanye siyakwazi eGoli sebeze babuyela eZimbabwe bakuma quarantine centers khona manje. So ngale eGoli, ngale eBotswana, endaweni ezitshiyeneyo sokuzalele ingwe. Sizwile futhi lapha ke Jonga ukuthi kulabantu abavela ePhilippines, kulabantu abavela eNamibia, labanye ade beduzane le-States khonapha eFlorida ababuye imkhumbi lapha amaship ukuthi phela umkhuhlane lowo kade subahlasele kakhulu. Sebebuyele njalo eZimbabwe, abanye bakuma quarantine centers anjenge-Rainbow Hotel lendaweni ezitshiyeneyo. So i-diaspora ngapha kukhanya kulobuzima Jonga, akunjani?
Gibson ndiri kuonawo patweet ichangobva kuiswa navaniki mangwana vanove munyori mukuru mubazi rezvoburuswa kwemashoko vari kuburisaiwo tweet iri kuti police have stopped the ZANU-PF from staging a demonstration at the American embassy in Harare against the brutal murder of a black American George Floyd and the illegal sanctions imposed on Zimbabwe. Ndofunga pakuine vanhu vanga vachida kunoratidzira kumuzinda weAmerica kuZimbabwe pamusoro pekufa kwakaita George Floyd vari mumaoko emapurisa. Saka vanhu nhengo dzeZANU-PF dzachifunga kuenda kunoratidzira ikoko. Saka ndonyaya iri kuiswa patweet panapa navaniki mangwana vachikota bepanhau reHerald kuti ndo zvaitwa izvo. Mapurisa arambidza nhengo dzeZANU-PF dzachienda kunoratidzira kumuzinda weAmerica pamusoro pekufa kwava George Floyd, pamusoro pamwechetewo nezvirango zvinonzi zvakatemerwa Zimbabwe neAmerica. Ndo nyaya yaiswa patweet navaniki mangwana. Todzokera zvidu kunyaya yedu yatiri kukurukura. Dr. Nyashanu, nzira yamungakurudzira nayo veruzhinji vari kumusha, tiri kuona kuti wakawanda vanhu vari kuZimbabwe. Ndinoona pasocial distancing pamasocial platforms apa, angava matwitter iwaya nafacebook nezvimwe, tiona mavhidhiyo nemifananidzo. Vanhu vakawanda vanenge vasiri kutevera kana kurudziro dziri kuitwa nebazi rezveutano kuti vange vachipfeka maface mask iwayo, vachishandisawo masanitizer nekusakwazisana kumbundirana. Hanzi nemumwe andakabvunzawo hama yangu ndikati kose musiri kudaro zvikanzi handingarasi chivanhu kana kurasa mutuko nekubvakati. Ndizvo zvamungataura pamusoro penyaya?
Maita zvenyu vakandemere. Zvinhu zvinenge zvakanaka zvikuru kuti sei vanhu kana muchinge kwaitika chirwere chakaita sechichi munge muchitevedzera aya tinoti masafety rules. Zvinhu zvakafanana nekupfeka mamaski muchivhara mhino dzenyu, nekunge wakamira uri kure nemumwe, nekuti chirwere ichi chinotapurirwana neutachiona hunofamba nemudenga, zvikuru sei uri padyo nemumwe wako. Saka vanhu vanenge vachifanira kunge vachiziva zvinhu izvi. Ina hangu ndinoti ndichiwedzera pamusoro ipapo, zvinhu zvakakosha zvikuru kuti hurumende idzidzise vanhu, zvikuru sei vanhu vanenge vari kumamisha, kuti chii chiri kuitika uyezve vanofana kuti vaite sei. Ndo panenge pachifana kushanda vaya vatinoti vana utsanana, vanenge vari kana health system yedu yakasimba, vachifana kunoshanda mumavillages vachiunganidza vanhu vachifambisa shoko ravo. ndinodawo futi kutaura zvimwe zvinhuwo futi tinongoti hatitaure takanangana nevanhu chete. Pane yavanoti the 1986 Ottawa Charter on health promotion symposium yakaitiwa, pane zvisungo zvakaitwa kuti kana muchinge muchishanda nevanhu mumacommunity vanofana kunge varivo vanhu vanoziva kuti zvii zviri kuitika. Haikona kungoti munongouya mototi mangwana hamusi kuita izvi, vadzidzisei. Iye zvino ndiri kuona kuti sekuZimbabwe, yes zvakanaka zvelockdown, asi lockdown iyi tiri kuita senge tiri kukopa. Munoziva munhu ainzi kwanza ari kukopa zvanyora mumwe, taakukopa nezita. Ndiri kudaro pamusoro pei. Iye zvino vakataura nenyaya yekuti vari kumisa vanhu kuti vasange vachifamba-famba. Hapana chakataurwa pamusoro pepublic health statement ine vanhu vanenge vaine atinoti machronic condition. Vanhu ivava havasi kunzi vanofamba, hapana kana chakataurwa, zvongonzi garai kumba. Zviri kuita sei? Kune vanhu vane high blood pressure, kune vanhu vane diabetes, kune vanhu vari kutora manhingikiri on HIV and retrovirals. All these people are deemed to be the vulnerable members of the society. Kana tiri vanhu vane hunhu vanoda kuprotecta vanhu, those are the very things that zvatinofana kunge tichiprotecta vanhu. Chimwe zvendanzwa kuti government yaita zvakanaka kuti kune vana vachaenda kuzvikoro. Ndanzwa vachitaura zvinhu zvakanaka zvezvikuru zvekuti vana ava vanofana kunge vaine mamaski, vanofana kunge vaine zvese izvi. Zvinhu izvi zviri kutaurwa in a low income country isina any support system. Chii chiri kuitwa nehurumende kuti ione kuti iri kudzivirira vana vechikoro ava? Ndo zvatinoti isusu kana tichiita mapublic health policies edu anofana kuve robust, tested, supportive of the people, and very, very well researched. Haikuna kukopa zvinhu zviri kuitika kuSanton kuSouth Africa muda kuuya nazvo kuMbare. Zvinonetsa.
Aiwa, thank you so much. Panyaya vamwe vanenge vaine zvirwere zvinoda kutanga vachiwana mishonga, ndakamboona hurumende inenge yakambozivisa kuti zvakaita sevanenge vachida ma-antiretroviral vari kubvumidzwa kuenda kufamba vachinotora ma-antiretroviral kumasenda kwavagara vachitorera. Handizivi kana pane chati chashanduka, Gibbs.
Yeah, let's hear what the doctor is saying about that, right?
Yes, doctor, maybe you can recap that in English. And I just said that the Permanent Secretary for Information, Mr. Nick Mangwana, I think some time last month, he emphasized that those who are on chronic medication, they are not stopped from going to collect their medication, including those taking antiretrovirals. And I understand they were saying they're going to get like a supply for 3 months, and they changed that to 6-month supply. Go ahead, Dr. Nyashan.
Yes, it's very good when it's being said by politicians. We have people on the ground, but my research has been that people have actually been stopped by police, and they are asked to produce a card or to say, I'm going to collect medication, some of which is actually being said by the police. It doesn't matter. And I'm talking about people who are actually saying this. And it is also disrespectful for a person with a chronic condition to produce his or her documentation from the hospital to say that I'm going to collect a medication for diabetes. I should not be doing that. And what help is being given by the government for these people who are living down there in Zoa and they want to get to Chinoi, yet we know that there is no transport. How are they getting there? Has the government put anything in place for those people? These are the vulnerable people that we should look after. And this is what I'm saying. Let's not just do a lip service and copy policies from other countries and then superimpose them on our country, which is a low-income country with a very dilapidated health system. There is need for help, a lot of help. taking into consideration that more than 90% of the Zimbabwean able workforce is not in employment. And these people have not been supported in any way. What do you think about those people who are actually getting, who are on chronic conditions? I think there is need to pay attention to these people. If we are to say we are helping our communities in these hard times, this is what is all about public health.
Thank you very much, Doctor. I'll stay on the line. Let's bring in Ezra Chisa Smanda. So, Chisa, we know that you know it's difficult to get money. Yes, kubeka baba, kubeka. Yeah, nxa sikhangela ke ukuthi kuzima ukuthi lithola imali. So imali kodwa liyayithola njalo nxa liyithola kubobani. So nxa likhankasa khona ukuthi lidingele uzulu.
Yeah, into enhle imali le ngayivela esikhwameni sami anginamali mina. Into le ukuthi nje abantu bangithemba, people trust me. So into enzakala ngenza lokho ekhaya ngisebenzisa amaphepha lawa ke ukuzilibazisa ukucela ngifake ingcebethu ukuthi abaphosele engcebethini umhlaba wonke le ingcebethu yangibona sesithatha leyo mali bese sithenga lezi zinto. Imali vele abantu uzulu abantu bala imali phansi. Bayofuna uncedisa omunye afake 5 pounds, omunye 10 pounds, omunye 20 US$, omunye 5. Nxa sibaningi singaka labalandeli bamabona njalo sesifaka senthala ngethe.
Yes, singathi kuzima kangakanani ukuthi ukwenza khona.
Kunzima kakhulu ngoba kumele uhlale ubacela ubakhuthaza bakhona ukukhuthaza ucele. Kumele ucele babone zini ukuthi imali yafuneka bathengisele ama-receipt nxa usithengi.
Yeah, so the question in English is, you know, Chisa, how difficult is it to fundraise, you know, for your activities?
The good thing is that I've been a very lucky guy. I don't use my money. I don't have money to be funding all these projects, but I rely on people's generosity. What happens is that I use what we call crowdfunding. I appeal through my social networks. Those have got so many followers. A lot of people trust me that whatever I say, whatever I do deliver. So therefore, I appeal to the people. I show them because this is why this is done. And then keep on.
I think your network is breaking. His network is breaking. So maybe let's try something so that we can get back to him as soon as possible. Come in there, Tonga.
Yes. Dr. Nyashan.
Yes, is there, yes.
Is there?
Yeah, I'm here.
Yeah, Dr. Nyashan, we have been, like of late, we have been noticing that many Zimbabweans, especially in the UK, were affected by this COVID-19 or coronavirus, those who are working in the health sector. Is there any change now, noticeable change? Because of late, many people were being infected and some have lost their lives during that time. Is there any noticeable change in the way people are now behaving at work, at home, and also the employers? Are they providing, because some of the health experts were accusing the employers of not providing adequate protection to their workers?
Yes, I will answer this question in twofold. Yes, in the first place, yes. Why do we have a lot of ethnic minority groups being having a low survival rate when they are affected by coronavirus? One of the main things that has been known for a long time is the inequality disparity which is there. When we start from at world level, at global level, we have the north-south divide, where we have low and middle-income countries, people living in squalid conditions, and we also have the developed countries. Already, that social divide has got impact on how people are going to withstand the power of any infection which they have. And this has not changed, even if you get into these developed countries as well. The Black communities has not been favored by the system. There is a lot of inequality. They live in deprived areas, yet they are the ones who are found on the front line, especially when it comes to health services. This is one of their main occupations. And there was no surprise that why is this social group being affected more? Having said that, let me look at what is happening in the UK at the moment. Definitely there's been a severe shortage of PPE in the nursing homes. Although they started getting PPE for the NHS, a big part of the health system in the UK is also run privately, especially when it comes to health and social care. And you find out that in these nursing homes, there hasn't been enough PPE, which has affected the lives of many people. And then we find our people or people of color being on the forefront, and they are being affected. At the moment, looking at the people's awareness, yes, people are now aware. However, they cannot negate the social history, the deprivation they suffered, the economic status. That still stands as a disadvantage when it comes to disease infection. But in terms of them learning, people have actually learned a lot, and they are enforcing a lot of social distancing. And I think my friend Ezra would actually, say the same, that we have been out, we've not been out for a long time, and we've not seen relatives. It has all been on social media. And things are starting to get better, not knowing what will happen. Will we have a second spike following the opening up to the economy and opening up of schools? Although there are all these modalities that they've put to support the system, we don't know. This is a volatile situation which can change anytime, and there is no robust information as to how this pandemic can change.
Go ahead. Yes.
Thank you so much. Thank you so much, Dr. Nyashano. Gibson, ndizoti nguva yedu yakamira sei, ndiwe timekeeper, but tinogona kunzwa kuna Ezra ndofunga adzoka.
uEzra ubesukile lapha because inetwork yakhe ibingani sequntekile. So ke okhulunywa ngudokotela lapha uqakathekile kakhulu. Uyatshengisela ukuthi khona ngale abantu nxa behlezi e-UK kumbe besebenza, abanye bangikhona ngabantu abasebenza imisebenzi ephansi. So ke bagcina akho nto imisebenzi ephansi kuphela, lapha abahlala khona kungani kuyahlupha, baminyene njalo kunjalo nje ukuthi kuyabasinda. So doctor, under those circumstances, do you see another spike in UK cases?
It's not known, but you will wait to see whether this is not going to happen, because we will see the opening up of certain things, opening up of schools, and these children are coming from different households and they are going back, and we will soon see the opening up of the pubs and all that. That will remain to be seen, whether the virus is going away or there will be a second spike, but it's not known at the moment.
Thank you so much, Doctor. I think we are coming to the end of the show, but I think Ezra Chisaspanda is trying to come back, but I think he has got a slight challenge with his network. So we assume that he will come in shortly. So kulabo awusanda ukusikhuluma khona manje, namhla ke besikhuluma kumbe ngithi esikhulume ngakho kakhulu ikhona ukuthi coronavirus COVID-19 ime ngaphi. So ke kodwa uhlelo lethu siyakwazi ukuthi lingafisa ukuthi mina lo Jonga siqhubekele phambili lo hlelo ukuthi isikhathi phela sesingani sidliwe ngumangoye. So Jonga, I think we can ask Dr. Nyashano for his last word. Just your last word to say, 30 seconds, just 30 seconds.
Yes, I really urge the government of Zimbabwe to look at supporting vulnerable people especially those from rural areas, they must provide transport for these people to be able to collect their medication. They should also make sure that when schools open, they should not only talk about PPE, but also to provide a robust supporting system that will enable schools to protect the children and the teachers from coronavirus and subsequently the communities. Thank you very much.
Thank you so much. I think we've come to the end of our show today. We wish to thank Dr. Matthew Nyashanu of the University of Nottingham. Trent is called Nottingham Trent University in the United Kingdom. Thank you so much, sir. Nyabona njalo ke Ezra Chisa Spanda simbongela ukuthi ubuyile khonapha ungathina kusasa Chisa. Jonga, this is Gibbs Dube in Maryland.
Neni Jonga Kademiri ndiri Maryland zvakare morera zvakanaka tosangana sondorunouya nekuti nge sangana zvakare mune zvimwe zvirongwa zvestudio 7.